So let's move on to another story. Another biotech had some good news on the FDA front. Cara Therapeutics, ticker there is CARA, and its partner Vifor Pharma announced on Monday that the FDA had approved Korsuva for treating moderate to severe pruritus associated with chronic kidney disease, and this is in adults undergoing dialysis. Cara shares soared on this news, which kind of makes sense, but do you think the stock is still a buy now?
Yeah, so pruritus is itching. I mean, literally, that's you just itch, and that's the symptom, which always seemed like a weird symptom for people on dialysis. But I went and looked it up, and it's caused by a combination of things. I guess dehydration, since the dialysis removes water, and then also high levels of phosphorus can cause you to want to itch. So I guess those one or the other, or a combination of those two, causes people on dialysis to feel like they need to itch their skin. This is the only drug that's specifically approved for itching associated with chronic kidney disease in adults undergoing dialysis. Cara gets 60% of the profits in dialysis clinics that aren't run by Fresenius, and then 50% of the profits in Fresenius's clinics, and that's because Fresenius has a deal with the other company, of Vifor Pharma, and so that's why the breakdown is different for Fresenius, the clinics that are run by Fresenius and the ones that aren't. I think the bigger opportunity here is in atopic dermatitis, or also known as eczema. That has probably more patients, and a lot of those patients also have itching associated with their atopic dermatitis. The drug had disappointing data in April from a phase 2 study, but the companies are pressing on. It still hasn't recovered. The stock hasn't really recovered that much, and it's down about, it's only about $750 million company. So that seems reasonable price for valuation for the dialysis indication. And then eczema could offer substantial upside from here, but the data for the phase 3 will obviously be quite a while, because we're just in the process of starting that.
Yeah, and I think it'll be interesting to watch too as Cara pursues the non-dialysis, trying to be able to treat pruritus in patients who aren't on dialysis, and it'll be a while before we see results from those studies. But this is an interesting stock to watch, and I think you mentioned it's only about $750 million in market cap now. That does seem pretty reasonable for where Cara is right now.
Yeah, I mean, I think the issue might be that, if they can't get profitable based on the current indication, because they're sharing profits, and then they're obviously going to have high R&D expenses. Now they're going to have to sell shares, do a secondary offering, and so maybe that dilutes the current shareholders. And so then if they do get a bump, the bump isn't going to be as big, because it's got to be shared. The new valuation's got to be shared by more people.